Welcome to the Holistic Health Show, where the worlds of science and spirituality converge to illuminate a path towards total well-being. Join us as we embark on a journey to bridge the gap between Western medicine and complementary therapies. Hello, everyone. Welcome back again this week. I'm so excited to have you here. We have another brand new topic for you today, and we are talking with Heather, the hygienist. The topic today is gum disease and gut health. So thank you, Heather, so much for joining me on the show. It's an absolute pleasure to have you here. I would love for you to please introduce yourself. Tell us a little bit about why you got into what you do, how you got into what you do, and we'll just go from there.
Well, first of all, thank you so much for having me, Amy. I really appreciate it. So, I've been a dental hygienist now like 28 years, and I grew up on a farm. My parents were hippies, so everything was, pretty much natural. But after I had my twins, I really had to start learning how to read a label because one of my little girls had 25 different food allergies. She was very sickly and all kinds of issues. And, you just have to be so careful. So, you really learn how to read a label, but it really wasn't until 2010 that I started to look at the ingredients in oral care products. And when you're in dental hygiene school, you're taught fluoride, fluoride, fluoride. And, so I just thought I was doing the right thing by promoting this to my patients. But then when I realized that the reason why these chemicals are really allowed in oral care products is because your oral care products actually fall into the category of cosmetics. So that's why they're allowed to put these like carcinogens in your oral care products. And, when you stick something into your mouth, Amy, it goes into your bloodstream. So, that really bothered me. And when patients would ask me, what mouthwash, what toothpaste do you recommend? I would go to the health food store and I was like, there's got to be something that's clean and green and also effective. But there really wasn't. I was actually even shocked when I started looking at some of the ingredients in products at the health food store. And I'm like, why is Poloxamer 407, which is an endocrine disruptor linked to breast cancer, why is that in this, quote unquote, natural product? So honestly, through a series of, I would just say, divine revelations, Simply Silver Mouthwash came into being. And now we have three different mouthwashes, three different toothpaste, two breast sprays, and everything is really carefully sourced. It's all natural, but it also works because, I'm not going to make something that isn't effective for people, but I really wanted everyone to feel comfortable with what they were using to know that it's not going to, it doesn't need a poison label, which that's why fluoride has a poison label because it's a mutagen in a labeled poison, but it's actually going to be effective for you. So that's kind of a quick little breakdown as to how Simply Silver came into being.
And I think I need to backtrack because I have so many questions all of a sudden. All of this is news to me.
Mm.
So, okay, let me regroup here. So I go to the dentist regularly,
Mhm.
and I like to think that I take very good care of my teeth. And isn't fluoride the one that they put on afterwards so that you don't hurt? It takes away the sensitivity?
Fluoride itself is really not what desensitizes teeth. It's usually the potassium nitrate. But yes, they do tell you it is to desensitize your teeth. But the whole premise behind fluoride is, oh, you're going to have a cavity if you don't have fluoride. Fluoride
Mhm.
is in absolutely everything. If you get a cavity, Amy, I guarantee you it's not because of a lack of fluoride. It's in your water. It's in tea. It's in, it's been contaminated. It's in everything, all your oral care products. So you don't get a cavity from a lack of fluoride. I mean, our teeth are actually 89% hydroxyapatite crystals. So my products use hydroxyapatite to remineralize teeth because it's bioidentical. Your body recognizes it. It's natural. It's non-toxic. So you don't need a labeled poison warning on there. But I wanted to use, again, something that was going to work, but, not have any kind of a toxic reaction to your body. And actually, NASA is the one that came up with the nano form of it because when their astronauts would go out into anti-gravity situations, they would lose bone density and their teeth would be affected. So they created this so that way when their astronauts came back, it was working on their bone.
Oh,
and it's been fantastic. Actually, Japan has been using it since the 80s as their gold standard. And fluoride has been around for what, 65 years? Are you telling me we haven't come up with something better than fluoride in that amount of time? Of course we have. But it's just a matter of getting the awareness out there, and fluoride is a cheap chemical. It's very, very cheap. So of course, you have to watch people's bottom lines, but it's not necessary.
it makes sense to use something that's already
Yeah,
in our teeth.
absolutely. Use what your teeth are actually made out of. And if you get a cavity, by the way, that means that your saliva has dropped below a 5.5. So it's really more of an acid issue. So if you're removing the plaque, which plaque is part of everyone's saliva, it's that sticky biofilm that needs to be brushed off twice a day, morning and night, but with like an electric toothbrush for a full 2 minutes, and flossing in between the teeth, because a lot of times when the teeth touch, you can get a cavity in between there if you're not removing that plaque. Because when you have something that has sugar in it, which even ketchup has sugar in it, sugar plus plaque forms an acid. And that acid is what eats away at your healthy tooth. So if you're getting a cavity, you have really an acid problem, not a fluoride problem. So you want to watch the acid. So things that have a lot of acids would obviously be soda, which has basically a pH of 2.5 to 4. Battery acid is a 1, so you're drinking phosphoric acid. You got to watch your energy drinks. You got to watch carbonated water. Anything that really drops your saliva into that danger zone is going to kind of open up your teeth to being demineralized and creating that cavity that you don't want to have. So if you're brushing, you're flossing, you're eating healthy, because again, you are what you eat, you should not be getting cavities. So it's not a lack of fluoride problem. It's either a diet problem, it's a mouth breathing problem where you're drying out your tissues, or it's an acid problem. So, if you give your body what it needs, it's always going to try and heal itself.
I'm hyper conscious of my teeth now. Cosmetics. So it's in the cosmetic category. That to me seems wrong.
Exactly. Because what you stick into your mouth, like I said, gets into your bloodstream. That's why people that have a heart issue can pop a nitroglycerin tablet to save their life. Why is that? Because the heart is connected right here to underneath your tongue. So, what are you sticking into your body twice a day? What kind of chemicals? What is that going to do to your body over time as far as toxic overload? And so it's never been researched, but that's why I'm very passionate about it, because again, that was the last piece of the puzzle for me. I've been looking at all the food labels, but for 10 years, I was promoting fluoride, never even considering what I was putting into my body. And then when I started learning about it, and I'm in the field, and I was taught, honestly, in hygiene school, that anyone that opposes fluoride is a conspiracy theorist. And fluoride is so wonderful for you. Oh, it gets stored in your bones. Oh, it's so great. Yeah, it can cause bone cancer. And we are seeing so many young children with fluorosis now. And that means like their teeth are brittle. And can you imagine if your teeth are the windows to your bones, what their bones are going to be like? I mean, this is like really scary, and it's just not necessary. That's why I really feel that the nanohydroxyapatite is the future of dentistry. And now, too, the whole purpose of talking about the link between the Alzheimer's and the gum health and gut health is because now we can do testing of your saliva to determine whether or not you have the markers for Alzheimer's, pancreatic cancer, colorectal cancer, heart attack, strokes, diabetes, all from the bacteria in your mouth. So this is like fantastic preventative medicine that we can do now. And the reason why people that have gum disease have such a high instance of getting Alzheimer's is because if you think about your mouth, right? How close is everything to your brain? So the bacteria that rots your bone, eats your bone, what it does is it gets into your brain and it destroys your neurons. And that is actually called gingivalis, believe it or not. So that is why it's linked to Alzheimer's. And you want to think about your mouth as like a mini immune system, because you have this oral microbiome, and your gut, right, has a gut biome. So the two are related. So if your gut health is healthy, that's going to help your oral microbiome. But things that disrupt your oral microbiome, your mini immune system would be alcohol-based products. Fluoride disrupts it, acids disrupt it, bacteria infections if you're not brushing and flossing and you're leaving all that biofilm underneath your gum tissue, it's going to create an inflammatory response. So there's different causes to gum disease, and that's something a good hygienist, a good dentist is going to get to the bottom of is what is the root cause of your issue. But it's just so important to not disassociate your teeth from the rest of your body because this is really where true health starts. And that's again something I'm really trying to teach people about. You need to not just want to eat clean and exercise. You got to take care of your oral health, or I don't care what you're doing, you're going to have disease.
I'm kind of reevaluating my whole life at this point. I'm literally, as you're talking to me, thinking about what I have in my bathroom. And I spend a fair amount of time looking at the makeup I wear. I have autoimmune diseases and I have skin allergies. And so there are a lot of things within products that, while maybe we shouldn't be using them, I can't use them anyway. So I spend a lot of time trying to use things that are non-toxic, that are sustainable, that are not going to poison me. But I've never done that for the products that I put in my mouth. I've never questioned my dentist.
Well, and here's the thing too, mainstream dentistry, they're going to think you're crazy if you say that fluoride is bad. We are taught this in school. And so when you go outside of the box, and this is something that over time I've had to kind of like get out of my little putting everything in a box and have more of an open mind. And I think that has really helped me grow as an individual in all areas of my life is having an open mind about things. I don't know everything. I'm always learning and I love to learn about new things. So I think it's important to not just kind of say, oh, well, my dentist said this and leave it at that. I think everybody needs to be their own health advocate and everyone should look into this for themselves. But holistic dentistry is different than mainstream dentistry. So just talking to you about your autoimmune issues, my question to you would be, one, have you ever had any root canals? And two, have you ever had any teeth extracted? So when you remove a tooth, when you extract a tooth and you don't extract the ligament around it, you can create what's called a cavitation site. That can make you sick. That can create an autoimmune problem. And this is something, again, that's not ever talked about is cavitation sites, because without removing that, you're sealing that ligament basically down inside of that bone. And unfortunately, it may not manifest for years and years later, which is why no one puts two and two together. But a biological or holistic dentist has certain techniques that they can determine whether or not you actually have cavitation sites where those were. So I would find a holistic dentist that would check those areas for cavitation sites and see if maybe that could be an underlying root cause for you.
I'm almost embarrassed because I advocate for holistic healthcare, but I've never thought about it from like the dentist perspective.
Right.
It's just never crossed my mind. I brush, I floss, I go to get regular cleanings. I'm conscious that I'm not, I don't drink soda because I don't want all that on my teeth and in my mouth and in my gut. So I do all those things, but never did I think about like your toothpaste because it's kind of all one. Well, I mean, you have Simply Silver,
Yep.
but aside from that, you just go to the grocery store and you get the same toothpaste, just different branding kind of across the board.
And here's the thing too with toothpaste. So I actually put the RDA value on mine. And what that means is how abrasive a toothpaste is. So basically, right, anything over a 70 is kind of considered abrasive for your enamel. Sensodyne, which I'm sure you guys probably have Sensodyne in
The
Australia.
only one I use.
Okay. Well, they're between a 72 and a 79. Okay. But like your Crest Pro Health, I think that's between 146 and 150.
Oh, so I've got a little tick. I've got a tiny tick. I'm going to take that
So-
little win.
Do you know what like sandpaper starts at? A grit of 248. So some toothpaste is literally almost like liquid sandpaper, and you only have one coating of enamel. So you are not going to make your teeth whiter by using these really abrasive toothpaste. Over time, you're actually going to wear through your enamel, and that inner part of your tooth is called the dentin. Your tooth will actually look more yellow. So you don't want to use abrasive toothpaste. You want something low abrasive. So like anything preferably under 70 is best. Baking soda is the most mild cleanser that you can use. Baking soda, it's a 7. Stay away from charcoals, stay away from clays, okay, because those are way too abrasive for your enamel. Do you know how many patients come to me like in tears because they can't figure out why their teeth are so sensitive? And I'm first thing I say, what toothpaste are you using? And it's usually a charcoal toothpaste. It's just creating such horrible sensitivity. I mean, it's really fascinating how, again, putting that into your mouth really affects your overall health. But anything alcohol, that's going to disrupt your oral microbiome and can even cause throat and mouth cancer.
Mm.
Okay. Alcohol really disrupts your oral microbiome, and look for something pH balanced. Because again, remember that magic number for your saliva is 5.5. If your saliva drops below that, you're going to, potentially get a cavity. Well, most of your commercial mouthwashes are 4.2 to 5. So you're swishing with acid. Stop. Don't swish with acid. Use things that are alkalining to your mouth. Coconut oil, baking soda, xylitol. Xylitol is fantastic. These kinds of things are fantastic for your oral microbiome. They're not going to disrupt anything, not going to create a bacterial infection, not going to create a more dry mouth, which again aids in getting cavities. But I just am not a proponent of your commercial crap out there. It's horrible, toxic ingredients, and a lot of them even are banned in other countries, but they're allowed here in the good old USA. Like some of these dyes that they're sticking in things are terrible. And as I mentioned before, that Paloxamer 407, watch out for that. You do not want to use anything with Paloxamer 407. With little silver, but it was used in World War One. It's been used actually for like 1,000 years because it's an all natural antibacterial, anti-inflammatory, viral. It aids in wound healing. Here in our hospitals, they use silver nitrate. They use silver in diabetic wound centers. So it really does help aid in healing. And it does not disrupt your oral microbiome like the alcohol. So it's perfectly safe. And a lot of people also don't know that if you have a mercury filling in your mouth, you absolutely don't want to use anything with hydrogen peroxide in there because that hydrogen peroxide leaches that mercury into your body. So that's what I like about Koi Little Silver is it's safe for everybody. And it's just a wonderful natural preservative. So you don't need to put like a ton of crap into it because it's naturally stable. And then I use nature. The mint and the cinnamon contain something called raw croton lechleri sap, and that's a sap from the Amazon rainforest, also known as dragon's blood. But it's amazing for bleeding gums because if you were to like cut yourself and put this sap right on your wound, it's a liquid band-aid. So I use that, and people that have gum disease are actually, according to science, lacking CoQ10. So you want to be supplementing with CoQ10, at least 50 to 100 milligrams a day. Because what that does, Amy, is that helps your body fight off bacteria on a microcellular level, and it's fantastic for your heart. Again, the mouth and heart are totally related. 40% of the bacteria clogging people's arteries comes from their mouth. So that's why they say if you floss every day, it makes you 7 years biologically younger. So it's a great anti-aging. But yes, all of my products contain natural ingredients that are really wonderful and especially used in combination. In fact, my toothpaste is also an oil pull. So you can use it as an oil pull, you can use it as a toothpaste. I just love it. But I really wanted to have something that I could feel good about, so that I could recommend to people that just didn't have any of the junk in there.
Do you ship outside of the States?
I do, but the shipping is so expensive.
Yeah.
I have had some orders from Australia, but it was like really crazy with the shipping costs. And maybe someday we can manufacture over there. I'm happy to ship if somebody wants me to, but it's just pretty expensive. I do have a book that's a digital download where I talk about dentistry for dummies because I really want to educate people about what good dentistry looks like, what bad dentistry looks like, because this is something I see on a daily basis is people think that they're okay or they spend all of this money getting all of this dental work done And then they come and see me and it's a train wreck. And they've just spent thousands of dollars on horrible work. They were maybe even the decay wasn't even removed. They're worse off than they were before. So I really wanted people to feel empowered because 100 million Americans don't go to the dentist every year, pretty much out of fear. And I just wanted people to feel confident, to give them some knowledge. How do you really know if you have a cavity? Just because the dentist says, or I've taught you what you're looking for, and you can actually go to the dentist and say, "Well, I didn't feel a stick," or "Show me on the X-ray what you're talking about." That's really going to blow them away because nobody really questions.
I mean, when you're at the dentist, it's not like you really have an opportunity to talk to them because you get in the chair, they stick their hands in your mouth, they ask you a bunch of questions that you kind of grunt to, and then you're out the door, So you're not getting to ask all these questions, and you just put blind faith in them. And I think, knock on wood, I think I've had really caring and honest and lovely dentists in my life. So I'm very happy for that. But I can imagine that there's in every field, there's someone out there a little bit dodgy who might not be doing the right thing. And how do you
Mhm.
know? You're right. How do you
Exactly.
know? The dentist is already an intimidating place to be.
Yeah.
I do have really sensitive teeth.
Mhm.
And so I hate going. I love going because I like getting cleaned and knowing I'm doing the right thing. But it's a very uncomfortable situation
Well,
for
and there's some
me.
some tips and tricks I do give in my book that, and especially with women, because women that have been sexually abused specifically have a very hard time with that. So there's some things that I do discuss in my book to kind of help through those situations. And hopefully, people will get at least some nugget of helpful information in there. But yeah, I really just want people to be an advocate for their own health and to not be so fearful of the dentist because like I said, it's that fear that keeps people out. But what I always try and tell people is like with your vehicle, if you never gave your car an oil change, you never put oil in there, what's going to happen? You're going to blow your engine. That's going to be a very expensive thing. Had you been taking your vehicle in every 3 months or whatever, you wouldn't be in that situation. Well, in dentistry, teeth don't hurt until it's too late because your enamel has no feeling. So you won't feel a cavity until it's into the nerve of the tooth. So instead of it being $300, $400, it's three to $5,000 for one tooth, just one. And pain is not an indicator of health. And with gums, like your gums should never bleed. And most people don't brush properly. They certainly don't floss properly because I'll say, "Oh, how many times a day do you floss?" Or, whatever. "Oh, I floss every day." So I hand them the piece of floss. I'm like, "Show me what you're doing." Like, they're not doing it right. If you go underneath the gum all the way down and you're not somebody that flosses, you're going to be bleeding. And they're like, "Oh, well, I don't floss because I bleed and it hurts." Well, it's infected. And that's why it's hurting. So, flossing properly is exercise for your gums. So, the more you do it, the easier it gets, the better it feels, the healthier it is. But we don't want to let pain be an indicator of, well, everything feels fine. Well, yeah, okay, until it doesn't, and then it's too expensive to actually get work done.
And I always say it's really important to adopt a proactive approach to your
Yeah,
healthcare, and it goes the same for your teeth.
absolutely.
And I mean, if your health isn't going to encourage you enough, the terrifying idea of having to spend thousands of dollars to have a tooth
Mhm.
extracted, not to mention the pain that you're going to be in before you even get to that situation.
And, people say, "Oh, we'll just pull all my teeth." And I'm like, "Okay, yeah, we can amputate. We can amputate your limbs. We can give you prosthetics. Do you really want a prosthetic limb?" I mean, it's not this thing of, and you know what? Your teeth are linked to organs. Okay. So we don't just like cutting out your organs. Your teeth are alive. Like one tooth is linked to your pancreas. And so sometimes finding out if you're having an issue with an organ, figure out which tooth that is in the meridian chart, and then go to that and say, "Oh, well, I have a filling here, a mercury filling that might be causing this root cause." So getting to the bottom of what's going on is so important, but we never really put two and two together. It's like the head is some sort of a separate compartment from the rest of you. And it's not, it's the main compartment that needs to be looked at first. And as providers, I can tell you within 2 minutes whether or not someone has a massive infection going on in their mouth. Whereas when you go to a primary care doctor, they're going to have to run several tests and try and figure it out. I can tell like that really what state you're in, what's going on, look at your x-rays. And then we take a little, it's called a probe. It looks like a little ruler. And we can measure the space between your tooth and your gum and get a good idea of what, level you're at. Because a healthy gum, a healthy mouth is going to have numbers of ones, twos, and threes. Gingivitis is fours. Periodontal disease, which is where the bone is starting to rot, is going to be fives and sixes. And then you're going to have moderate disease. So that's why it's so important we try and catch things when it's early. When you start to get a 4, if you get a 5, you act now. You don't wait. You don't say, oh, well, just check it next time. It's no big deal. Well, guess what? That bacteria can spread from over here to over here. So instead of having maybe just 1 5, now you've got 3 5s, 4 5s. So it's just going to spread in your mouth. So it's very important that you try and catch early. Just like when you want to find cancer, stage 1 or stage 4, treat it early so you don't end up with tooth loss and being forced to amputate your teeth and deal with dentures. I mean, it's really horrible.
And don't your teeth keep the shape of your mouth and your jawline and everything?
Yeah, it really ages you. You don't talk the same, you don't look the same, and you certainly don't taste food the same. Your chewing force really goes down. And there's actually evidence that suggests that it decreases your lifespan as well.
And then I'm also, now that we're on the topic, I'm also curious about what are the teeth replacements made of? Like what are you then putting in your mouth?
So you can either do dental implants, which personally, I have a dental implant. It's a zirconia one because I do not believe in putting titanium into your jawbone. First of all, most women have an allergic reaction to nickel, which nickel is actually in titanium. So if your skin turns green from wearing cheap jewelry, you're going to have a reaction to that titanium. But never put metal into your bone so close to your brain. I like zirconia. It's a ceramic base and it's just a more natural alternative and very strong. And then pretty much the materials that they make either dentures or partials out of is like acrylic with plastic teeth. It just depends on really what that lab is going to make them. But you definitely have options.
Okay, great. Yeah. Still not my first option, knock on wood, that I don't never have to go there.
Well, and I think people are just so quick to, have that fast mindset. You want it now, but not looking at the long-term consequences of something. And I think, again, it boils down to educating people, but also going to the dentist for somebody that is dealing with gum disease. Twice a year isn't enough. You need 3-4 times a year. If you're somebody that builds a lot of plaque of tartar in your mouth, your oral microbiome is changing every 80 to 90 days, which is why you need to get your teeth cleaned more frequently so that bacteria doesn't recolonate in those areas, creating an infection once again. Now, if you're somebody that's, really not gum disease prone, but maybe you're more cavity prone, you can get your teeth cleaned twice a year. But if you're somebody that is really struggling with gum disease, the bleeding gums and all of that, you really need to get your teeth cleaned more frequently.
So anyone with a healthy mouth, is twice a year what's expected?
That would be fine if they're healthy. Dental decay is the number 1 disease in the world, but most people actually lose their teeth from gum disease.
Well, I've got a lot to take on board. I'm going to go floss my teeth as soon as we're done.
Right? Make sure you're doing it properly. Don't use those cheaters.
No, I won't use those anyway because of the plastic. But I want you to share with everyone. So you've got your digital download book, and then I know that shipping is expensive outside of the States, but for anyone who is in the United States of America, definitely hop online and have a look. So where can everyone find the book, the toothpaste, the spray?
They can just go to my website, simplysilvermouthwash.com, simplysilvermouthwash.com. So that's my website. I have blog as well. So I have a lot of pretty good topics on there. So feel free to read through the blogs. I actually have written 3 books. One is a children's book. And then the other one is an information book as well. But the Dentistry for Dummies is more of a handbook. And that's a digital download that people can get to help them kind of navigate through their own dental journey.
Well, thank you very much for the work you're doing. It is very important. It certainly opened my eyes. And anyone who is listening, if you have not been to the dentist this year, we are in November. So make that appointment and absolutely
Right.
go and get a checkup. Ask your dentist these important questions about what it is you're going to do and what you need. And Dentistry for Dummies, maybe have a little look at that and educate yourself on what you can expect and what you should be looking for. I'm very excited to pay more attention to this aspect of my health and get on board with that. So thank you for sharing this really valuable information and all of your knowledge with us today, Heather.
Well, thank you for having me. It's been a pleasure.
It's been my absolute pleasure. If you are watching this on YouTube, I would love it if you would like, subscribe, and hit the bell so you're notified for upcoming episodes. Comment on the video. You can ask myself or Heather a question. I get all the notifications, so I'll make sure that she gets any of your questions. And if you're on any of the other podcasting platforms like Spotify or Apple, I'd really appreciate if you rated and reviewed the show. It helps me reach more people, and they really keep me motivated. I read all of them, and I enjoy every single one of them, and they help me make better content. They help me improve the show every time. So if you could take a couple of minutes and do that, I'd really appreciate it. That's all we have for today. Thank you again, Heather.
Thanks for joining me on the Holistic Health Show and trusting me to guide you towards proactive healthcare. If you enjoyed the episode, don't forget to subscribe now on your favorite podcast platform and get ready to embark on an incredible journey toward holistic wellness. Until next time, be well and stay holistic.